Good morning. My name is Sana, and as a policy advisor of Health Authority of Australia, I would be discussing about analyzing and overcoming the problem of duplication in Australian healthcare system. Duplication basically refers to the phenomena in which people have access to not only public but also private healthcare funding, which can lead to overlap in coverage as well as inequity due to double dip caused by high income groups, leading to inefficiencies, moral hazard, selection bias, as well as out of pocket costs. As we can see from this picture as well, that in Australia, more than half of percentage of people have extra health cover covering any dental needs, optical, as well as physiotherapy needs. As a result of which, Australia basically ranks the highest in having out of pocket expenditures in comparison with USA, UK, Canada, as well as New Zealand. So, to mitigate these issues, we propose the policy of strengthening the Medicaid task force, and its main purposes were to promote equity, quality, as well as integrated care. And specific objectives were reducing overlap in coverage, providing greater access to primary care services of people, mitigation of fragmentation, leading to consumer engagement, as well as overall expansion of nursing workforce. So, in methodology, we basically used both qualitative as well as quantitative tools. In qualitative, we conducted various semi structured interviews which had predetermined questions, due to which we gathered various perspectives of various different stakeholders, which were quite beneficial. Case studies were also used because case studies provided real world data, and we would be discussing about cross country comparisons in the subsequent slides. Also, key performance indicators were used, and they were quite crucial for our policy, which we would also be discussing. Cost analysis as a quantitative tool was used, and we basically used national level data sets such as MPS, PBS, compiled from Australian Institute of Health and Welfare. Also, concentration index was quite crucial in our policy because it is an econometric tool and it captured the magnitude of inequality. The real world time data was used. Also, KPI like we compared length of stay of patients as well as patient waiting time in both public as well as private healthcare settings. And the two most crucial tools like patient reported outcome measures as well as patient reported experience measures were used because it was quite helpful to see any change in healthcare outcomes of people and also to record their experience while they receive their care. So now we talk about the most important topic, the cross-country comparisons. The first country, that is Germany, was used, and we gathered data like Germany basically used demarcation of both SHI as well as PHI insurances and also introduced various disease management programs, which basically led to decrease in fragmentation and increase in care of patients. So, what lessons Australia can learn is that by implementation of such programs, it can provide better care of patients as well as enhancement of disease management in chronic conditions. Second country was Canada, and it basically prohibited physicians to charge more than the public plan and basically led to attainment of universal coverage and also consequently led to elimination of duplication of health insurance. By implementation of such prohibition plan, it universal coverage can be attained at a cheaper rate. Lastly, USA was compared, and we gathered data that USA basically used coordination of benefits as well as affordable act care implementation, which consequently led to increase in equity, fairness, universal coverage, as well as increase in affordability. Uh, by using such plans, such as coordination of benefits, duplication of healthcare services can be mitigated at a greater rate, leading to a decrease in moral hazard. So we basically chose strengthening the Medicaid task force as the best policy reform because it directly strengthens the universal healthcare model, gives rise to flexible funding, and leads to overall improvement in quality of care of patients. Uh, there were two other options as well. Like opt-out solution could also be used, but we did not prefer it because it can cause political sensitivity, and also decreasing out-of-pocket costs can uh, lead to opposition from insurers because basically all insurers support policies that lead to profit neutral reforms. Uh, our strengthening Medicaid task force policy basically addresses efficiency, duplication, as well as sustainability by opening of urgent Medicare hospitals. And it is also very less arduous task for people to access primary care services, which leads to increase in sustainability and also gives rise to consumer engagement. So, overall, strengthening the Medicaid task force is not just a reform or a policy, but is a overall and long-term strategy to magnify and improve the healthcare of Australia. And as we discussed in the previous slides, by working on all of these foundational principles of healthcare, strengthening Medicaid task force can really unify health performance system of Australia uh, by increasing equity, providing universal coverage, and also as primary care services is the first point of contact of people. So by strengthening Medicaid task force, we can Australia can really achieve universal healthcare coverage at a quite shorter span of time. Although this policy is requires some initial cost, but it is quite beneficial for long term as a long term reform of Australia. Thank you so much.